On the back of the TRV chair, you will find the augmented stop arm. This is used for potentiated maneuvers. Keep the arm locked in the neutral position when you are not doing potentiated maneuvers. Lock the stop arm in the downward pointing position when treating posterior canal BPPV. The stop arm will now collide with a lower shock absorber, stopping when the patient is 45 degrees below a horizontal position. Lock the stop arm in the upward pointing position when treating horizontal canal BPPV. The stop arm will collide with the upper shock absorber, stopping when the patient is positioned horizontally. The stop arm can be activated prior to or during positionings as needed.